In this segment, we will be looking at the World Malaria Day 2024, accelerating the fight against malaria for a more equitable world. And this day, we unite under the theme accelerating the fight against malaria for a fairer world, urging actions to address inequality in the prevention and treatment access. The stall in global effort against malaria threatens public health and widens inequality. Many still lack affordable and timely malaria service, especially vulnerable groups like young children and pregnant women. Refugees, migrants, indigenous communities face heightened risks amidst climate change and humanitarian crisis. We are now joined in the studio by Dr. Dan Matthew. Dr. Dan Matthew is the program officer for malaria in AMAC. Abuja, it's a pleasure to have you join us this morning.
Thank you very much.
Good morning. We know you have a series of programs lined up today, but somehow you found time to be in the studio, and we appreciate the sacrifice. You know, to quickly start with you, what is the situation like in Nigeria with regards to access to treatment, especially by the vulnerable? I know you operate out of Abuja, but you can give us a sense of how we are doing as far as the fight against malaria is concerned.
Yes, good morning. I'd like to say one thing. The World Malaria Day is a day set aside to increase and sustain action, motivate agencies, and create a synergy so that there will be deliberate action towards the fight against malaria. Like you have said, so much has been done at the national, state, and local levels. And we also have a lot of interventions from NGOs towards the curative aspects of malaria. Like the Malaria Consortium, we are starting a program by next month. It's targeting children under 5 years. As a preventive measure, it's prophylactic because of the rainy season where we have high level of the infection. And they are targeting children under 5 years because they are the most vulnerable. And to some extent, the national is also doing a lot in prevention, providing mosquito nets and so on. The chairman of Abuja Municipal Area Council has done so much also to create community sensitization, awareness, and also sustain prevention, because prevention is key, and that is one of the most aspects that we want to call on government to deal with, because we need to begin to deal with the vector itself. Because if we deal with where the source, that is the vector, where the mobility and motility are, it will save us a great expense.
Right. And in talking about prevention, malaria vaccines have now sort of been under the spotlight for the past couple of months, especially towards the last quarter of 2023. We understand the World Health Organization has approved this vaccine rollout across the African continent. We do know that we bear a greater percentage of the global burden when it comes to the fight against malaria. What can you tell us about that vaccine rollout, what it means, and if this is going to be a silver bullet in our fight against malaria in this country?
Yes, the vaccine trials has been done, and I think the national and the states are planning the rollout plan for distribution. Is going to be very huge, and there's need for a very systematic and strategic plan for beneficiaries. Very shortly, the National Malaria will give us the details on the operational plan and distribution of the vaccine. Then we now talk about it publicly, and then we begin to implement and sustain, distribute. And the area councils are the implementation of most of these national programs, which include the primary health care, and sometimes even with the synergy with the secondary and the tertiary health care. Like I said, the malaria consortium that is doing the seasonal malaria chemoprevention, all those sectors, all those health facilities are involved, primary, secondary, and tertiary. For AMAC, we have like 55 healthcare facilities that will be participating and distributing and doing all the implementation.
Okay, just quickly, how do you evaluate what is a successful rollout? I'm saying this from the point of view of my own family. I stay within AMAC. I know how many times, I'm not sure about you, Abdul, I've had to treat, my household has had to treat malaria this year. And you, I mean, what are you focused on? Is it just about the primary healthcare facility, which most people do not access this because they consider them as places that are not adequately equipped to meet their needs? What other plans do you have in place to reach out, to as many people as possible, so that the impact of, that's why I was asking about how do you evaluate impact? Is it just by the numbers that show up at the primary healthcare, or is there other mechanisms that you can use to evaluate how successful your rollouts have been?
Yes, the burden of malaria is very huge. That's created a lot of burden to families. Once there's malaria infection within the family level, the household become a problem. You cannot go to work. It creates a lot of economic and issues and all sorts. But like you have asked, the burden, assessing the impact, is very viable, and the assessment from 2002 to 2022 2023, we have increase and decrease in value, because the impacts made because of intervention that's coming has reduced the morbidity of malaria in the FCT, especially in AMAC, to be more specific. But we are also thinking and focusing on prevention. By the time we deal with prevention, we deal with the vector, because we have indoor spray, we have larvicidin, the waterways where the vector is mostly found. By the time we create a very suitable environmental impact strategy, by like sanitation, we deal with so many things, because we deal with the vector directly. So I think just like we dealt with COVID,
we're looking at maybe fumigation practices and things like that.
Indoor spray, those are applicable, that deals directly with the vector. But if locally we can stimulate and sensitize our community to imbibe very good environmental practices, it saves us a great deal of eliminating the vector.
Right. Okay. Just before we wrap things up, I said the report available by the World Health Organization, Nigeria has an estimated 68 million cases and some 194,000 plus deaths due to malaria. That was the report from 2021. And Nigeria has, the highest global burden of malaria, accounting for nearly 27% of it. As far as the numbers go, what can you tell us about the level of progress we're making here in Abuja, and a sense of whether we're winning this battle or war against malaria? Because we know that it has cost this country so much, even though it's very clear that we've, made so many progress down the years. But what can you tell us about the level of progress we're making so far, and what we need to scale things up, so that we don't, continue to lose a great percentage of our population to this dreaded disease?
Just like you have said, there are other complications that comes with malaria. Malaria complications that results to death. But once malaria is detected, is treated, those complications are easily dealt with. But like I've asked, I think government is doing his best at national, state, and local government level, but we need to create a synergy, an action plan so that the occurrences will drop. Because the increase in death, like you have mentioned, is very complicated to really identify the cause, because malaria itself has other complications that comes with it, which results to death. And those are easily assessed by the primary health care facilities. And we have a system whereby once the primary health care facility cannot refer to secondary, so it's the secondary health care facilities that now begin to determine the cause of death, because there are complications. The symptoms of malaria is associated with so many other diseases. So most people, when they have fever, is assessed or is assumed to be malaria, but there are also multiple diseases that has similar symptoms.
All right. I wish we had time to continue to drill further on this, but we are pressed for time, and we understand that you have so much lined up for you today. We'll continue to keep track of development, including some of the programs you have mentioned. I want to thank you sincerely for finding time to stop by and share this insightful knowledge and information with our readers.
Thank you very much.
All right, we've been joined by Dr. Dan Matthew, who is the Program Officer, Malaria Elimination Program here at the Abuja Municipal Area Council. He's sharing very insightful information with us as far as today's special day, World Malaria Day celebrations are concerned, and all of the things that are lined up for today's event.